At the outset, I would like to thank KSOS and Dr. Chandrasekhar for giving me this opportunity. I'll be speaking on continuous quality improvement. So why CQI? As we know, healthcare interventions are intended to benefit patients. However, the hospitals can be hazardous and medical errors is a stark reality. Also, the risk of having adverse events is much more common in hospital than one can envisage. It is not uncommon to come across the news reports about patients getting operated using unsafe practices and getting infected, or patients losing vision due to botched up surgeries. And as a result, the doctors get sued or have to pay heavy cost. What is the root cause of all these errors? It is because of the system shortcomings, inconsistencies of processes and protocols, lack of standardized protocols and non-compliance with the protocols, or inadequate monitoring of the processes leading to gross errors. Also, incomplete medical records and documentation is a major concern. There are several examples where surgeons have to pay because of incomplete documentation. We are already aware that if there's no documentation, we cannot save ourselves legally. So we need to be very meticulous and precise. Also, with changing healthcare scenarios, quality has become the demand by the patients and has become the necessities in the hospital. So just technical quality is not enough, and the patients want services to be delivered on time, adequate information, they want friendly behavior, privacy and confidentiality, and the self-health care. So how can we integrate quality in our day-to-day practice and achieve continuous quality improvement? It can be easily done by focusing on providing evidence-based clinical practices, actively managing patient safety and risk, having proper infrastructure and robust system of infection control, and last but not the least is standardized system of measuring and monitoring quality to achieve continuous quality improvement. So in our quality journey, CQI not only helps in getting accredited, but also helps in sustaining accreditation by continually improving the process and systems and mobilizing both data, tools, and knowledge to improve decision making. The measurement and monitoring of quality in healthcare is a first step for improvement, and it can be done by using a set of indicators against standard benchmark. So you have to quantify the current level of performance with the expected standards and best practices or the benchmark and try to improve. So quality indicator is an agreed upon structure, process, or outcome measure that is used to determine the level of quality achieved. Indicators, since they are measurable, they provide a quantitative basis for evaluation of quality improvement. Eco Standard CQI 3 chapter provides a list of indicators, both clinical and managerial, which you can measure over a period of time to achieve improvement. And these are some of the examples of structural, process, and outcome indicators. The structural indicators include indicators related to manpower, medication, equipment, infrastructure, or training. The process indicator, one of the simplest example is time taken for initial assessment. And in eco standards, the time taken, the benchmark is 90 minutes. So one can always calculate the percentage of patients which were seen within 90 minutes. Other process indicators include waiting time, medical record completion, hand hygiene compliance, etc. The outcome indicators are very important because they measure the outcome of our services, and they include patient and employee satisfaction, infection rate, surgical outcomes, adverse events, adverse drug reactions, resource utilization, etc. So this is a list of indicators with their formula, which are given in AIOS CME series by Dr. Frederick, as well as in the NABH guidebook. And you can select any of them, a few of them, for the measurements. So some examples are number of patients who had best visual acuity of 6/9 or more on day one, number of patients or number of times patient had to return to OT unplanned, number of patients having satisfactory refraction, number of times the OT showed nil growth, number of sentinel events after surgery, including SSI, TAS, wrong procedures, wrong eye, wrong IOL. Sentinel events are very important to measure because they need immediate interventions. The OT utilization rate, number of surgery patients was rescheduled. Again, very important indicator is documentation of medical record because it keeps the track of completeness of medical record. Then time motion study, satisfaction index, critical equipment downtime. So development, measuring and monitoring of quality indicators is crucial, not only to enhance performance of the organization in the long term, but also enhance the patient satisfaction with the best care possible. So once you have finalized the indicators, you need to start collecting data, and you need to identify the data resources, and you analyze the data by applying scientific methods of formulas. Data interpretation is very important, and it will tell you what are the problem areas, what can be improved, and how can you achieve improvement. Also, you can set the priority areas which you want the improvement and methods to sustain improvement. So it is a vicious cycle of monitoring, measurement, improvement, and sustaining improvement. So these are some of the tools which you can use. PDCA cycle, root cause analysis, fishbone analysis, 5 whys, Lean Six Sigma, etc. So this is a very good example, the fishbone analysis, which is being done for endophthalmitis. So by simply brainstorming all the possible related causes of endophthalmitis, whether it is patient related or operating room process related or surgeon factors or surgical factor, you can just narrow it down to the root cause of the problem. And this kind of fishbone analysis is very useful in finding the causes of day-to-day incidents. Now, these are some of the indicators which we have been monitoring for the last 8 to 10 years and with remarkable improvement. OT starting time and utilization, I feel, is one of the most important indicator, because if operation room is well utilized, you can improve efficiency, reduce overtime for the staff, reduce OT running expenses, improve manpower and equipment productivity, and this will ultimately lead to financial gain. And as you can see, when you stop monitoring, the parameter will drop. So it's very important to monitor. Similarly, OPD starting time, again, the measurement will help you to adequately staff your OPDs, schedule the number of patients, reduce waiting time, and you can see more patients, therefore, to improve the productivity and ultimately improve patient satisfaction. So this was time motion analysis or waiting time analysis 2 years, almost 3 years back. And that time, the OPD waiting time or the total time spent in OPD was almost 3 years. So we just tried to find out the cause of long waiting time, and we just thought it could be poor scheduling or shortage of staff or starting late or untrained staff, and we just took the corrective actions and also stringent monitoring of OPD starting time, because most of the times the OPD started late. So it helped us to improve our parameter largely. Also, the patients who wait more than 3 hours. So we just try to find out the cause, whether those patients are undergoing some investigations or dilatation or there is no cause. And we found that in the morning hours, most of the patients had more waiting time. So when you do the analysis, you can just plan some interventions like rescheduling of appointments to afternoon, increased manpower in morning hours, and increased OPD capacity. And as you can see here, by interventions, you can improve your waiting time. And the overall patient satisfaction index will also improve. Other indicators which are important are hand scrubbing audit or hand scrubbing percentages. And in COVID time, it should be 100%. Post-operative infection rate, surgical complications. And so this is the dashboard of quality indicators which we monitor on a monthly basis. And we share all the indicators performance with the stakeholders, and then the improvement measures are taken. Now coming to audits, which is again a key element in achieving continuous quality improvement. And audit, as you know, is an evidence gathering process by systematic evaluation of data, documents, and resources, and to check if the performance of systems meet specified standards. So basically to identify gaps and opportunity for improvement. So this is the example of medical audit which we do on a monthly basis for each specialty, and the parameters are reviewed for completion and appropriate documentation in the form of history, general ocular evaluation, specialty evaluation, investigations, photographic documentation, management plan, and outcome. So we just measure on the scale of not done, done but not appropriately done, or appropriately done. And as you can see, over a period of time, there's a lot of improvement in these parameters. Internal audit is again done on a regular periodic basis to check compliance with the processes. So these are the audits of different departments and should be performed at least quarterly, and reduction in non-conformities over a period of time is the progress indicator. It's important to complete the audit cycle every time by re-auditing and closing the loop, and then only you will be able to make improvements, as well as you will be able to sustain those improvements. So to conclude, continuous quality improvement is very important, and for that you need to create quality culture within the organization. It should be leadership driven. There should be focus on patient safety. One should encourage the incident reporting, the root cause analysis, and corrective action, preventive action, without penalizing the staff member or without blaming them. Continuous training is very important so that everyone remains on the same page. Audit, as I said, is very important tool, and indicator monitoring again is very important over a period of time, and reviewing of those indicators and their performance. And last but not the least is development of information system for involvement of stakeholders and making them accountable for improvement of their own department. Thank you very much for your kind attention.